You're good to
Try
go.
it again. Okay, I'm ready.
And it's recording, so.
Okay. Hello, I'm Dr. Erik Martin. I'm an emergency physician, and I live in Joplin, Missouri. And I am talking to Lex Baird, who has the coronavirus and is a current patient who's doing quite well. So, Lex, can you just introduce yourself and tell us a little bit about yourself?
Yep, sure. Hi, I'm Lex Baird. I live out in, as many of you may know, northern Jasper County, out in a little town called Next City. I'm in my third year at Columbia University, and I was studying abroad in France up until this whole thing started.
Thanks, Lex. When do you think you caught it? Do you think you were in France when you caught it, or you'd mentioned that you were traveling back through New York? Where do you think you caught it?
So, given the timeline, I feel like I probably caught it in New York. With the incubation period of 14 days, it is possible I could have caught it in France, but considering there still weren't a lot of cases, the area I was in wasn't particularly contaminated. I feel like in the 5 or 6 days I think that I spent in New York is probably when I caught it. I had a friend. I had a friend who knew somebody who on campus had tested positive for the virus. So that at the moment is the most plausible case for how I caught the virus.
Okay. So any idea how many days between the time when you were around that friend till when you started feeling sick?
Mm-hmm. Well, I probably saw them, I think the first time I saw them was the 7th or 8th. Mm-hmm. And I saw them, I believe, a couple more times before I left New York. So I probably could have seen them as late as maybe the 10th.
Okay.
And then I became ill on the 18th.
On the 18th?
Yes.
So that could be as long as 7 to 10 days, it sounds like. Does that sound about right?
Sounds about right.
Okay. And what was your first, how did you feel when you first started feeling sick?
Mm-hmm. So it was the day after I got back to Joplin. And I came down with a fever. I was feeling, very tired, sort of flu-like minus the nausea. I did have a bit of a light cough and some aching, but I think the primary thing was the fever for me.
Okay. And how high was your fever?
Initially, the fever went up to about 100.5, and then at its highest over the course of my illness, we measured it as high as 101.5.
101.5. And you had a dry cough. You weren't coughing up any phlegm.
That's right.
Did you have any runny nose or sore throat, anything like that?
I did have a sore throat at one point. The day after I got tested, I woke up with a really sore throat.
Okay.
I was super weak. I could barely walk to the bathroom. But my breathing was fine, surprisingly.
Did you ever have any chest pain or tightness, anything like that?
I could have possibly described some tightness in my chest at some points while I was ill. But it was never severe enough that I felt comfortable, honestly, describing it as a symptom, just because it wasn't enough discomfort for me to really notice it.
Sure. So once you started feeling sick, did you think you could have had the coronavirus?
Yeah. Once I became ill, that was actually pretty much our first thought, considering I had been, to France and then New York after. Both obviously big areas in the news, with travel ban in Europe and everything. Right. So that was really our first thought when I got sick, was that it probably was the coronavirus. I had been self-quarantining up until then, the best I could, since I had been to such high-risk areas. So it really came as a surprise when I got sick, to be honest.
Okay. And when you started feeling sick, how did you go about getting tested? Who did you contact, and what did you do?
So when I got sick, first we tried to call the coronavirus hotline in Missouri, but that was super backed up. So we called the Freeman ER directly. And, we told them I'd been traveling. I just gotten back from New York. I was feeling sick. And so they agreed to let us take a test there. We drove straight there, got tested, drove straight back. And then 2 days later, they called me with the results and told me I had tested positive.
So you tried calling the Missouri hotline and couldn't get through?
Exactly.
Okay.
My mother was waiting, and she was maybe like 40th in line, and it was moving, maybe one slot every 2 minutes. So she decided it would be a better use of her time to just call the ER directly.
Sure. And when you called the ER, you told them you'd been traveling and you'd been to a high risk area, so they were prepared for you?
Yeah, that's correct.
Okay. And once you were in the ER, so you got swabbed, you got tested, and then you went home. Is that right?
Yeah, we actually did all the testing in the ambulance bay, and then
Oh,
they
okay.
came out all suited up, took a quick test, got some information, and then we went straight home.
Okay. And you were put in home quarantine after that, self-isolation.
Yeah, exactly.
And what day was that exactly? That was last Wednesday, I believe. Is that
Yeah.
correct?
So yeah,
Okay.
that was Wednesday evening.
And was that the day when you started feeling sick, or was it the day before that?
That was the day I started feeling sick.
Okay.
Yeah.
So you started feeling sick, you had a fever, had a cough, felt achy, and then you went and got evaluated and tested.
Uh-huh.
And so since you've been home, that was Wednesday of last week. It's Wednesday today, a week later. How have you been since then?
I felt great. So after I became sick on Wednesday, I was sick for one more day. I was sick on Thursday. Like I said, I woke up that morning. I had a sore throat. I was super tired. I could barely walk to the bathroom.
Hmm.
And I just got myself locked in one room on the opposite side of the house from my grandparents. Um, but then honestly, by Friday, the symptoms were mild to non-existent. And Saturday, I felt completely fine, and I haven't felt any symptoms up until this point.
So
Uh,
for three
so
days, you had a fever, cough, felt bad, but really by Saturday you felt better.
really, more 2 days. The fever itself had actually
2 days.
gone away by Friday.
Mm.
It was just some light coughing, some aching.
Okay.
But by Saturday, it was gone. Yeah.
And since then, you've felt fine. You haven't had any residual symptoms. No more cough, no shortness of breath, nothing like that.
Nothing like that.
Okay, great. And so, who called you with your results? Was that the Freeman ER? Was that the state health department?
So it was actually the Jasper County Health Department that called me.
Okay,
And then they were actually the only people that I've been in contact with from the medical community in Missouri regarding my infection. So they've
okay,
been my first and only point of contact throughout this.
sure. Have they been in touch with you every day or periodically?
Yeah, they asked me to keep them updated on any developing fevers in my family or other symptoms.
Sure.
So we've been texting them daily, telling them what the temperatures were, if there were any fevers, or if other symptoms developed. Um, and yeah,
Okay. So you've been more or less symptom free since Saturday, and you're not even in self isolation anymore, are you?
that's correct. I just asked them today if I was free to quit isolation, and they said yes.
Okay, because you've been symptom free for more than 72 hours. Is that what they wanted you to do?
That's correct.
Okay. Has anyone else in your family felt ill?
Yes, my grandparents today actually started coming down with some symptoms. Um, no fevers between either of them, but with my grandfather, it's difficult to tell because he takes a arthritis strength Tylenol,
Mm-hmm.
which could possibly be suppressing his fever. Um,
Sure.
but both of them have felt tired. My grandfather especially. And then last night, my grandmother described it as like her hacking up a lung and just aching all over. Um, so my grandmother contacted the labs today to get tested, which they'll be doing tomorrow.
Sure.
Um, she
That's
described the
That's at the Thousand Oaks here in Joplin. Did you call that the local hotline?
Yeah, that's correct.
Okay.
She said it was a bit grueling to get approved for testing, but eventually she did. So they'll be going out tomorrow at 3.
Okay. And so they live there in the same house as you. You're pretty you have pretty close contact with them.
Fairly, yeah. I mean, we've tried to, sort of keep our own worlds as much as possible.
Right.
But because of the natural intimacy of the setting, it's hard to
Sure.
maintain total isolation.
But once you'd come home from New York, you were with your family for a few days before you started feeling sick. Is that right?
One day, yes.
One day. Okay. And you came home from New York last Tuesday. Is that when you got back to Joplin?
Yep,
And you started feeling sick the next day.
correct.
Okay. So if your grandparents get sick, it's possible they caught it a week ago when you were around them before you knew about it. Is that right?
Yes, and we're monitoring other members of our family to see if they get symptoms as well. I've been in close contact with a few other members of our family who live in the house or who visit the house often, and so we're monitoring them closely.
All right. Well, thanks for doing this with me. It sounds like you're doing great.
Yep.
I think there's a lot of anxiety out there that a lot of people feel because this is such an unknown thing.
Mm-hmm.
From my reading about this, it sounds like you're a pretty typical case amongst young people. You're doing well. You had a mild illness that just lasted 2 or 3 days, and you feel fine. Is that right?
Yeah, that's correct. If really since Saturday, I would say I felt completely asymptomatic. No shortness of breath, no fever, no nothing. I felt good as a fiddle.
Okay. Thanks a lot, Les.
Yep, sure thing.